Welcome to the Tech Talk, Mobile Healthcare Applications by Lieutenant Commander Tiffany Aranga and Lieutenant Colonel Danette Cruthertz. Views of this presentation do not represent nor are authors financially supported by outside or commercial entities. This includes the United States Navy, the United States Army, Uniformed Services University of the Health Sciences, and Naval Postgraduate School. This presentation will define mobile platforms and mobile applications. It will give an overview of the landscape that surrounds mobile healthcare applications, as well as the social impact of this mobile technology. The general types of healthcare applications will be touched upon, as well as a brief description and examples of their current use. Benefits and drawbacks of healthcare applications will be described. And finally, the future of healthcare applications will be discussed. Let's get started with laying some groundwork with defining basic terminology. Mobile platforms. These are commercial or off-the-shelf computing devices that are handheld in nature. They may be with or without wireless connectivity, although wireless connectivity in most instances significantly expands their utility. Mobile applications are essentially a type of software that are executed on a mobile platform remotely or may require connection to a web-based server. Some mobile applications, or shortened to the word app, are tailored to specific mobile platforms, although others are designed to perform on a myriad of devices. Within the realm of apps, there is a category or classification that encompasses those that have relevance to healthcare or are somehow connected to health-related topics or maintenance strategies. In a broad sense, they generally have application to improving well-being through dissemination or collection of valuable health information. The target audience and function varies widely by individual app, thus spanning a large spectrum. Stakeholders may be patients, healthcare consumers, as well as students or novice providers to the most experienced healthcare practitioner. Mobile health apps may include, but do not obligate, the need for attachments or accessories, such as sensing apparatus that convert a mobile platform into a mobile medical device. Medical devices, whether mobile or other, due to their potential risk to patients, are governed by the regulatory oversight of the Food and Drug Administration. Thus, it is easy to appreciate that a legal ethical ambiguity surrounds medical devices, specifically those that are apps. It is advised that all app designers consult the FDA for guidance on regulatory requirements as they apply to specific applications. In review of the evolution of mobile healthcare apps, the underpinnings begin with the fundamental technological revolution that has occurred over the last half a century, but has manifested in the most extreme exponential growth in the previous 3 decades. Mobile computing and communication devices have revolutionized our everyday life. They are embedded in virtually every aspect of our waking day. It is truly an exploding industry with no apparent end in sight. The healthcare industry has been slow to embrace the social phenomena that has been termed BYOD, or bring your own device. However, the concerns that have stalled expeditious adoption have included credibility of information, security and privacy protection, and integration of back-end support. Nevertheless, the challenges are steadily being overcome, and portable modalities and applications are becoming omnipresent in the healthcare industry today. Out with our old, the textbooks, two-way pagers, and desktop devices, and in with the new, our apps in the form of e-books and the host of mobile platforms such as smartphones, laptops, and tablets that support the countless mobile healthcare apps. Faster, smarter, and stronger is where we are headed today. Indisputably, mobile healthcare apps provide access to exhaustive amounts of healthcare information. Moreover, this information is accessible virtually anytime, anywhere. Apps can record or provide information that can be as simple as a wellness device that counts steps to a comprehensive reference that outlines clinical practice guidelines that help to facilitate clinical decision-making and/or a critical diagnosis. Two statistics that help drive home the magnitude of healthcare apps are, in 2012, an estimate put the number of health-related apps to no fewer than 40,000. Just 3 years later, approximately 500 million smartphone users worldwide were noted to use healthcare apps. I'd say those numbers are quite remarkable. This popularity is exemplary of the fact that mobile healthcare apps are indeed transcending the limits of traditional medicine, paving the way for healthier patients through advanced means to provide better professional and self-care. One could take all day and still not be able to completely wrap themselves around all the various types of mobile healthcare applications that have been created and or available for consumer use. Here is provided a general outline of the various app classifications. Treatment apps are those that aid in the medication administration, such as reminding patients when and how to take certain drugs. They may also include reminders for certain procedures and appointments, as well as serve as a means for initiating prescription refills. Mobile healthcare apps can turn mobile platforms into mobile devices. This includes the attachment or accessorizing a platform that allows the app to mimic a medical device function. This can occur in real time or asynchronously, capturing data that is later relayed to healthcare providers. As previously stated, this realm of mobile healthcare application is heavily regulated by the FDA, and consultation with this agency is highly encouraged if unsure of classification. Educational healthcare apps encompass those with or used for medical training and referencing. They teach and or coach, and they can also provide interactive feedback through knowledge testing or simulation through the management of or honing of skills that would occur in a real-life scenario. A final category is that of data collection, sharing and storage of healthcare-related information. This type of mobile healthcare app is commonly used to facilitate general office operations, manage and track hospital staffing or patient census, and the paperless storage of patient health records.
Mobile devices have been used in clinical care by physicians for the last 2 decades. In 1999, use was estimated at 15%, increasing to 60% in 2005. In 2011, the prevalence of clinical smartphone use by physicians in ACGME programs in the United States was estimated at 88%. As previously mentioned, mobile healthcare app use is steadily increasing as well. As of 2013, smartphone technology provided access to more than 100,000 medical applications on the 2 main mobile device software platforms, iOS and Android. 50% of these mobile healthcare apps are directed at healthcare professionals. Further, in the United States, recent data suggests 85% of young people own a smartphone, and 3/4 of that number have used their device to access healthcare information. The figure shown here is from the 2014 4th Annual Study on Mobile Healthcare Apps, published by Research to Guidance, a strategy, advisory, and market research company. The report analyzes the global app publishing activity of the 12 leading pharma companies on Android and iOS devices. The top 5 mobile healthcare apps include fitness, medical reference, wellness, nutrition, and medical condition management. Benefits are being seen through the use of mobile healthcare applications. 2 examples include medication adherence and patient symptom data collection. With the emergence of the non-warfarin oral anticoagulants that do not require regular blood tests for therapeutic effect, monitoring adherence became a concern. The short half-life of these drugs compared to warfarin warrants consistent and sustained medication adherence. This is crucial to maximally reducing risk of stroke. Automated phone or text messaging has been described as a useful intervention in some healthcare systems to improve cardiovascular medication adherence. Furthermore, smartphone programs allow researchers to recruit large numbers of participants and monitor them in real time for remote data collection. A physician in Washington state wanted to determine how the wildfires raging through the state were affecting people with asthma. 8,700 asthma patients with the Asthma Health iPhone app were able to be recruited and real-time data was obtained. Findings showed that when the fires flared up, so did asthma symptoms, and reports of environmental triggers among users living near the blazes occurred. In this Global Mobile Healthcare Apps Market Survey conducted in summer 2010 by Research2 Guidance, they list multiple diseases and healthcare conditions where mobile health can have the biggest impact. Topping the list are diabetes, obesity, and hypertension. As mentioned in the previous slide, the top 5 mobile healthcare apps include fitness, medical reference, wellness, nutrition, and medical condition management. Unfortunately, there are still many drawbacks and barriers in this rapidly growing market of mobile healthcare apps. This includes, but is not limited to, lacking evidence-based guidelines, lacking management of large volumes of data, and having difficulty finding clinically relevant apps when needed. For example, there are many suicide prevention apps available, some of which provide elements of best practice, but none that provide comprehensive evidence-based support. In addition, a number of apps have been found to contain potentially harmful content. Despite the number of apps available and their varied purposes, there is a clear need to develop useful, pragmatic, and multifaceted mobile resources for this population. Clinicians should be wary in recommending apps, especially as potentially harmful content can be presented as helpful. For the clinical management of large volumes of data, it is not often known what to do with the large quantity of data collected, or even if it has relative importance. Security may also be lacking in the data collected and how it is managed, and there are often limitations to the predictive analytics of the obtained data. Sifting through the available mobile healthcare apps to find one that is relevant can be a daunting task. There are no real strict criteria as to specific content that should be contained in a particular app category. As an example, 20,000 apps in the iTunes App Store have been categorized as medical. 7,699 are related to emergency medicine. The breakdown of the related emergency medicine apps is listed here. As you can see, over 64% of these apps were not even relevant to medical professionals. That is almost 5,000 apps that takes both time and resources to determine the lack of relevancy. From the before-mentioned Global Mobile Healthcare Apps Market Survey, experienced mobile health and traditional healthcare market players predicted the barriers that have been seen over the past years. The drawbacks mentioned in the previous 2 slides are seen in the bar graph here, and they include lack of standardization, security, regulation, and access difficulty. The future of mobile healthcare apps has yet to be determined. By 2018, it is estimated that more than 3.4 billion smartphone and tablet users will have accessed mobile healthcare applications. This includes both consumers and professionals. In addition, it is estimated that the global market revenue will double in 2017, reaching over $26 billion. The impact on the healthcare industry goes much further than pure revenue generation opportunity. 5 areas stand out as those which are predicted to have the greatest impact on healthcare. Quality benefits such as improved outcomes of treatments and improved prevention and education are seen as the top 2 domains on which mobile healthcare applications will have a significant impact. Besides, mobile healthcare is believed to slow down the increase in healthcare costs, improve interaction between patients and doctors, and last but not least, enable patients to better take care of their own health. As this presentation draws to a close, you will find listed here some popular mobile healthcare applications for both healthcare professionals and patients alike.